This is NDTV. And you're watching NDTV 24/7.
Hello and welcome. You're watching Living with COVID. I'm Bhardwaj. This is the show where we help you navigate with the new normal that we're living in. We have a panel of expert doctors who will answer your questions on the coronavirus. Dr. Dinesh Kumar joins us. He's an MD practicing physician and diabetologist from the Harsha Clinic and Diabetes Care Center in Lucknow. We also have Dr. Bhardwaj. He's an MD pediatrics and a DM endocrinology. Also the medical director of the Dr. Bhardwaj Hormone Clinic in Jabalpur. Appreciate you, doctors, for sparing the time of day. Dr. Bhardwaj, if I can begin by asking you, what are some of the steps that you're taking to screen patients, segregate them at entry points, to make sure that, you know, your waiting rooms, etc., are safe for patients so that when they come to you, they are not exposed to the risk of contracting the infection?
You see, there are two sides. One is the clinic staff and the patients and their attendants who are at risk of developing or contracting the disease. For this reason, we begin with the clinic staff. Everyone in the clinic wears the protective gear. It includes the head cap, it includes face shield, face mask, protective gown and hand gloves. This is compulsory for everyone, including me. Then we have a habit of taking off shoes for everyone. So this is again practiced by everyone. We follow the same procedure for the patients also. When they enter the premises, they wash their hands with soap and water. At the entrance of the clinic, they take off their shoes, helped by an attendant to sanitize their hands. They are requested to cover their face with a face mask or with a hanky or with any cloth that they have. In the clinic, they are requested to maintain the space. We have adjusted the chairs in a manner so that there is minimum 4 to 6 feet distance between the two. And in the clinic, we have junior doctors who look after, who take the history and do the physical examination, and then they come to me. After evaluating them, the prescription is handed over. Between the patients, each one of us sanitizes their hands and they take the medications and leave the clinic. At the time of leaving the clinic, again they are requested to wash their hands. So this way we try to maintain adequate degree of distance, adequate mouth cover, and hope that it would not transmit infection either way. Nor the clinic staff, nor does the patients or their attendants would contract the disease.
All right, Dr. Bhardwaj, if I can come to you at this point, how can people who are suffering from diabetes keep themselves safe, especially if these people are, you know, say going back to their office spaces, they're accessing common areas? What are the additional precautions that they can take?
You see, diabetes is a state of compromised immune system, and since it is an infection, it is likely to be more severe if it affects the diabetic person. So they should be more careful. They should wear a protective mask, maintain adequate distance, cycle to their office if it is close, or if they are using a public transport,
right,
they should maintain adequate distance. In the office premises, it is the duty of the administrator of the premises to maintain the adequate hygiene, adequate distance between the staff, and the staff members should carry their own food and drinking water to the working place. If they go to the cafeteria, they should again maintain adequate spacing between their colleagues and themselves. Wash their hands before leaving the cafeteria.
Right.
If possible, they should have a hand sanitizer with them to sanitize their hands whenever they visit a place outside their table or outside their cabin.
All right. Dr. Kumar, if I can bring you into the conversation, you know, two very important aspects. One, of course, on the accessibility of public transport, and we'll come to that in just a bit. But, you know, if you could elaborate some of the steps that you're taking to sort of, you know, implement testing of patients to become safer. So when people are coming for examinations or testing procedures, how do you ensure their safety?
See, I find that the most vulnerable person is the person who is going for the blood test. I mean, the attendant, my lab assistant who is collecting blood from the sample. So I ensure that he himself is wearing all the protective gears as mentioned by Dr. Bhardwaj. He's as protected as I have taken all the precautions. I'm wearing all the PP kits. He's also wearing the same PP kit, headgear, face shield, mask, and all the gloves. And I ensure that his blood collection is in a separate chamber and that he is not exposed to the patients and the patients are not exposed to him. Only one person who is actually collecting, going for the blood test is there in the chamber.
All right. So I think, maintaining that level of distancing and sanitization in between patients is very important. But what about patients, Dr. Kumar, who are coming to you? People who are, say, accessing public transport, or people who are using public transport to go to work. Is it safe, and what do you recommend?
See, first of all, using public transport, if at all they have to use, it's mandatory for them to use public transport. Then only these rules apply. Otherwise, they should prefer the private transport at this juncture. For the public transport, I think authorities first of all have to ensure that the bus doesn't get crowded. They maintain a proper distancing among the commuters in the bus, and the passengers should ensure that they leave their house early so that they don't have to catch a crowded bus. They should ensure that they are boarding a less crowded bus. The bus which has a proper cleaner with a proper mask, a driver with proper mask, a sanitization facility in the bus, and they should ensure that they are seated in the bus. And the bus authorities also should ensure the passengers don't stand in the bus, because if they are holding the hand grip and holding the rods for support, then the next passenger is vulnerable to the COVID infection. So these are the precautions that both the authorities and the commuters both have to take.
All right, of course. So there are certain SOPs that need to be followed, even when you are in or using public transport. And of course, it is avoidable at first, but if you must absolutely use it, then you must follow those precautionary measures. Since we have both the doctors on the broadcast today who are diabetes expert, let me shift our focus to some of those questions. What's the advice that you'd like to give to patients to effectively manage their diabetes at home? Dr. Bhardwaj, if I can come to you first, and if you could talk a little bit about the element of diet and exercise.
The diet is one of the main reasons why lifestyle diseases occur. Diet and exercise. Improper diet and lack of exercise in the first place cause diseases like diabetes, blood pressure, and their treatment also demands that we make appropriate changes in diet and physical activity pattern. Diet should be a balanced one. It should not be a bland diet. It should be a balanced diet. It should be an appetizing diet. A diabetic person can take everything which a normal person can take except sweets and candies. Every other food cooked in the house can be taken. They should avoid eating out or ordering from outside. Cook food at home. Eat vegetables and salad in plenty so that the bowel movements are proper. The feeling of satiety is there. Take roughage. Do not remove the bran from flour while cooking the chapatis, and it is necessary that they take plenty of water. Water is also a nutrient. Almost 2/3 of our body comprises of water, and water should not be deprived. A person, if he or she is well hydrated, is likely to have his blood sugar under control. Exercise is equally important. A person can do stretching exercise indoors, can use a static cycle or a treadmill. He or she can go upstairs and walk on the terrace, and if facility permits, if the government authorities permit, they can go outside and have a walk, maintaining adequate social distance, physical distance, and wearing a mask. So exercise, leading a healthy life, leading an active life, avoidance of sedentariness and avoidance of junk food and fast food are a must if they have to maintain their glycemic parameters in the targeted range.
All right, so very important to maintain a balanced diet and of course regular exercise within the permissible limits of wherever you're living. But Dr. Kumar, if I can come to you, the other very important aspect of diabetes management is medication and regular monitoring. What would you recommend to your patients at this time?
See, this is a very crucial juncture in which we have found that the patients who are diabetic are more vulnerable for complications. Not necessarily the infection. Infection can happen to anybody, but diabetic patients are more vulnerable to complication. So this is the time that they have to be very particular about blood sugar monitoring. They should, if they have a glucometer with them, they should go for almost daily monitoring or maybe twice weekly or thrice weekly monitoring. They should be very strict with their diabetes control. They should be if they don't have a glucometer facility at their home, and they should go once in a month at least out of their house to get the blood sugar checked up once in a month, or let us say once in 15 days, and A1C blood sugar, this is average blood sugar measurement, once in 3 months. So these are the two basic tests which they must get it done in the next coming months. Regarding medicines, it will be advisable for the patients not to stop or reduce the medicines without the advice of their doctors. They should somehow try to contact their family physician or diabetologist, whoever is taking care of them, either personally or by telemedicine or maybe by WhatsApp, so that they present their blood sugar reports at a particular time and get their medicines adjusted by the doctor himself, and should not reduce or increase the medicines on their own. So that is very important for all the patients who are suffering from diabetes.
All right, do not self-medicate is a very crucial message. We're going to slip into a very short break, but our panel of expert doctors is going to continue to be live with us on the other side. Stay tuned.
Knowledge Partner, USV, your reliable healthcare partner.
Welcome back. You're watching Living with COVID. Dr. Bhardwaj, if I can come to you, what's the advice or tips that you'd like to give to your patients regarding effectively managing hypertension at home?
You see, hypertension is a common comorbidity of diabetes. Almost half of diabetic patients have hypertension. That is about 2 times more than general population. Similarly, they are also at risk of having cardiovascular disease. Both diabetes and high blood pressure are important risk markers for the two. So diet again plays an important role. They should take less of salt, less of canned food, less of spices. They can take peas but not the masala of pickles and papad. They should use a simple papad, not a masala papad, and should take plenty of oral liquids. As per requirement, they can take medication, but along with that, exercise is again a must. An aerobic exercise, that is cycling, walking, swimming, jogging, step walking, that is standing at same place and walking or moving the steps. These are the important steps,
Right.
other than adherence to medication.
All right, Dr. Kumar, if I can come back to you, at a time like this, especially during the monsoons when people tend, to catch the common flu, how can one distinguish between symptoms of a common flu and the coronavirus, given that there are a lot of common symptoms?
Yes, you are very correct that it's very difficult to differentiate between the two. Normal common cold, influenza or COVID-19 symptoms are almost the same. If you list fever, cough, running nose, headache, myalgias, they are all the common symptoms which you find both with common cold or viral fever of influenza and COVID-19. They have these common symptoms. Two symptoms which have come out these days, which are unique probably to COVID-19, is loss of smell and loss of taste. Though present in only 20% of the patients, but these two symptoms are the unique to COVID-19. So this is one of the way you can judge probably. Otherwise, if you actually see the patients of COVID-19, as time goes on, fifth, sixth day, their symptoms tend to increase. For example, they are having severe myalgia, as severe we have never seen in influenza. They are having very severe myalgia, so much so that they cannot even walk at times. Patients of COVID-19 are very dull. They are not able to keep themselves awake. And of course, if they land up into breathlessness or chest pain, severe headache, then we come to understand that probably this is going towards the complications of COVID-19, and we should get an RT-PCR or the tests meant for COVID-19 and go ahead with the treatment of as COVID-19 protocol suggests.
All right. So, of course, very difficult to differentiate, but there are some telltale markers that you can watch out for. Dr. Bhardwaj, could you explain if there are more complications that are seen in cases of COVID-19 in diabetes patients?
As I said earlier, the diabetic is a state of immunocompromised condition, and a person who contracts the infection is more likely to have a severe disease. He is more likely to be hospitalized, less likely to be asymptomatic or mild disease. If he is hospitalized, he is likely to stay longer in the hospital. He is more likely to be admitted to ICU, more likely to require assisted ventilation, and more likely to die. So all these complications, right from becoming sick to a greater extent up to various stages of severity of illness leading to mortality, are more common in a diabetic person. And in addition to appropriate and specific targeted management of COVID infection, they have to maintain good nutrition, they have to maintain good glycemic control, good control of their blood pressure, blood sugar, and take all necessary precautions.
All right. Dr. Kumar, what are the special precautions that one should take while taking care of the elderly at home? Especially if you are going out to work or, you're going about your regular life, but you have elderly people at home who you're regularly interacting with. Two parts to the question. One, of course, on what are the extra precautions you need to take while you're dealing with them. And second part of the question is, what extra care can be given to the elderly at this point to sort of, build immunity or just safeguard them from the infection?
Regarding the first part, how I should be taking care of them. See, being a doctor, I'm already very much exposed to COVID-19. So even otherwise, if a person is going out and has a public dealing and he knows he can get exposed to this virus, we all should ensure that we are interacting the least with our elderly, our parents. And if at all we need to visit their room or talk to them, we should be wearing masks if at all we are interacting with them. Otherwise, we should try to avoid interacting directly with them and stay at a safe distance, especially being doctor. And others also who are dealing with other public dealing, they have public dealing, then they also should be taking precautions with the parents. Number one. Number two, if a person who is traveling daily to his office, if he finds that he has symptoms of fever, cough, cold, whatever, he himself should be self-quarantined. He should, in fact, avoid getting in touch with his parents or elderlies in the home at all. He shouldn't get in touch with them. Now, regarding taking care of the elderly as such, of course, these elderlies are more prone to complications, as Dr. Bhardwaj mentioned about diabetes. These elderly are also more prone for complications. So we should give them immunity boosters like vitamin C, zinc, and vitamin D. They should be regularly on these medicines. And if they have any comorbid conditions, like they have diabetes or blood pressure or cardiovascular disease or maybe cancer, their medication should be given on time. Their blood sugar, blood pressure should be measured timely, and we should ensure that these comorbid conditions are well under control.
All right. But is there anything you'd like to add, Dr. Bhardwaj? Because, of course, one vulnerable section of people is the elderly. What about people who have, infants or children or even newborns at home? What are the kind of precautions that they can take at a time like this?
First thing is that parents should not take their children or elderly members to to the doctor's chamber. If it is absolutely necessary, if the child is affected or if the father or mother is affected, only then they should accompany the patient to the clinic. They should interact minimum with outsiders, children and elderly people, and they should stay active. They should be engaged appropriately with indoor activities. They should not be allowed to get bored. They should be taken care of in a manner that they do not feel as if they are being deprived of something which is due to them. So they should be happy. They should be involved in day-to-day activities with maintaining a safe distance and taking care of their health. Vegetables and fruits and nuts, they provide natural vitamin C, other minerals, zinc, and they would help in maintaining their immunity level, and they would also protect them from the disease.
Okay.
Vaccination can be done as and when required.
All right, so it's very interesting that you talk about immunity. Let me give the last word to Dr. Kumar. Then, Dr. Kumar, what are some of the ways in which even otherwise healthy people can further build their immunity, so that they can protect themselves from the infection or have a better chance of fighting the infection? What are some of those absolutely essential things that one must do to build immunity?
See, whenever patients ask me about immunity factor, even before COVID-19, I feel the best immunity booster is exercise. Somehow you can, if you are not allowed to go out, you can use your terrace, you can use your length of the building that you live in to have a walk of around 30 to 40 minutes. If you are not able to walk, I think meditation, some kind of a yoga will help you to boost your immunity. That is very important. Even if you are maybe any person in this world, best immunity booster is exercise. Anytime, even if there is COVID, post-COVID or pre-COVID. Number one. Number two, diet of course plays a very good role, as Dr. Bhardwaj said. Nuts and green vegetables are very good source of vitamins and B complexes. And of course, if artificially or in the form of tablets, we can give vitamin C, zinc, and of course, I am giving to all my family members vitamin D regularly for immunity.
All right, and that of course, should be the last word. So you must eat your vitamins regularly, and of course consult with the doctor if you do feel weak or feel like you're unable to cope with anything at this time. Thank you so much, doctors, for sparing the time of day and answering our questions so very patiently. Thank you.
Knowledge Partner, USV, your reliable healthcare partner.